going to talk about the RAPID Appliance, the new RAPID Appliance. The RAPID Appliance has always been used for a few different functions. The main one is to use it for the restorative process, sending the records to the laboratory. The new RAPID Appliance has pink on it, so we have a little bit different function that we're recommending. And that is that when the patient comes to restore their case with you, rather than sending the patient home in the surgical prosthetic that they've been wearing, we're suggesting that you send them home in the RAPID. Our goal is to make you prototypes and finals more efficiently, to get you to a printed try-in. Traditionally, when a patient comes for the restoration, the doctor would take the surgical prosthetic out and would add tray adhesive to the intaglio of the RAPID Appliance. And the RAPID Appliance would be seated, they would be backfilled with Reline Impression material to capture the new tissue levels. And then you would also capture a bite and send it in with photographs. But one of the key parts of that is equilibration. Because the patient has been wearing a surgical prosthetic for the past several months, they've not been wearing the RAPID Appliances. And quite often with the RAPID Appliance, there are metal cylinders and there is resin that's on the occlusion or on the lingual of the teeth. And in order to equilibrate, you may have to adjust metal, you may have to adjust resin, and you're essentially recreating a bite. So our solution is, why not send the laboratory the bite that the patient has been wearing and creating for the past several months? That is where the pink RAPID comes in. So now what we're suggesting is that when the patient comes for their restoration, take the surgical appliances out of the mouth, put tray adhesive on those, and reinsert, perform a Reline Impression on the surgical appliances and capture a bite. We know that the bite's been worked out. The patient's been wearing that bite for several months. We know it'll be accurate and we know it's exactly what you're looking for. So the surgical prosthetics come out with, take photographs, take them out with the Reline Impressions with the bite, send that to the laboratory, and you'll send the patient home in the RAPID Appliance. Now, maybe that'll be a little bit of adjustment of the metal cylinders and the resin, but this could be just for several days. When the case comes at the laboratory, we will articulate, we'll digitize it, we'll get ready for planning and designing the restorations, but we could send you back the surgical prosthetics for the patient to wear. But in the meantime, the patient has a RAPID Appliance with pink on it instead of just monochromatic. A really nice solution. Another consideration, which is very important, is that the surgical appliance will generally not include a second molar or enough distal extension for that patient. The RAPID Appliance does. That's why we've always designed the RAPID Appliances with more of an extension so that you can do a Reline Impression and capture the ridge under it to add the cantilever. So in those situations where you're going to send us the surgical appliances, we can still work through this. What we want is just an additional impression, either digital or analog. When the prosthetic is out of the mouth, capture the ridge and the MUAs, so just the tissue and the MUAs only in either a digital impression or just take an alginate and pour it up or take a PVS impression. That'll give us the extension and we will build out to that in the software when we're designing the restoration. Another consideration is if you are restoring these cases with our SmileLock or our C2F process. And the only difference there is when you are sending us the records, make sure you include the SmileLock or the C2F model along with your prosthetic and the Reline Impression and the bite registration, because more than likely we can use that model to make a soft tissue model and then to make the final restoration. So there are a couple of contraindications for this. One is if the patient has really worn down their teeth, worn down these temporaries during the restorative phase, during the healing phase. And if they have collapsed their bite down, you may not want to restore that collapsed bite. You could still send those records to us and we could open up the articulator a couple of millimeters, but you just have to see how comfortable you are with that situation. If you're in that situation, you could use the RAPID Appliances still to send us the records. The other situation is if the prosthetic has had any kind of breakage to it. You want to make sure that you have it intact, luted in the mouth passively before you would use that record to send to the lab. In conclusion, you'll send us more accurate records. The patient will have a much better experience, we think, and will shorten the number of appointments you have to get to a final.